Hello, my name is Kayla Fast. I'm from the University of West Alabama, and this is a brief introduction to advances in phage therapy of mycobacterial infections. This video is part of a series put together by the institutions shown here. This material is based upon work supported by the National Science Foundation, and any opinions, findings, conclusions, or recommendations presented here are those of me, the presenter, and do not necessarily reflect the views of the National Science Foundation. Bacteriophages, or phages, are viruses that infect bacteria. Phages are the most populous entities in the biosphere, and they are essentially parasites of bacteria. And this is because a phage cannot reproduce unless it first infects a bacterial cell. Once a bacterial cell is infected, it dies, and we can use that cell death to our advantage. This is where phage therapy comes in. Phage therapy is the use of phages to treat pathogenic bacterial infections. This is a promising alternative to antibiotics because phages are host-specific, infecting a single host species or just a few closely related taxa. They are found naturally in the environment and in the human microbiome, and so are generally well tolerated. In the last 100 years or so, there have been different trials in different disciplines, but today I'm talking about phage therapy in mycobacterial infections. First, let's look at a recent successful phage therapy case. This involves a patient with cystic fibrosis who received a lung transplant and then developed a severe Mycobacterium abscessus infection, which could not be treated with antibiotics. And so a group of doctors and scientists began phage therapy. In the figures here on the left, we can see first an increase in lung function after phage therapy began. These scans show an increase in function of other organs, like the kidneys, and here we see visual healing of wounds on the skin after phage therapy. One additionally phenomenal thing about this case is that some of the phages used in this treatment were initially discovered by college students who were part of the C-Phages program. They were looking for phages in the soil that infected non-pathogenic bacteria. The University of West Alabama was not a direct part of this cystic fibrosis case, but we have discovered 22 phages in the soil and have annotated 9 of their genomes. Non-pathogenic bacteria can be used further in phage therapy by using those bacteria as a delivery system. There have been some trials using Smegmatis, a non-pathogenic bacteria, to deliver phage into systems that need to be cleared of Mycobacterium avium and Mycobacterium tuberculosis, the causative agent of tuberculosis. Phage therapy involving mice and Mycobacterium ulcerans, the causative agent of Buruli ulcer, have also shown some promise. So here on the left, we first see a case where in mice that are experimentally infected with ulcerans, there is a decrease in the thickness of lesions on the feet after phage therapy began. In histological sections, we see an infiltration of mononuclear cells indicating healing, and other studies have shown a decrease in colony-forming units of ulcerans after phage therapy began. I'd like to conclude by saying that I think that this is a really exciting advancement in the medical field. I hope that you think it is exciting, and we'll keep an eye out for what's coming up next. And lastly, thank you for watching.